This lecture is entitled Wound Care Classification. In this lecture, we're going to review some very critical elements in the management of a wound care patient. We're first off going to start talking about what happens during the initial wound care consultation. We know there's a lot of information spinning around. What do you do with that? Then I'm going to talk about the rationale for classification, and it's quite simply the rationale is taking all that information that you obtain and putting it into a framework that is can be utilized for the clinical management of these patients with chronic or acute wounds. And the classification system that I'm going to suggest to you is one that's based on both the appearance as well as the etiology, and there's very definite reasons that we're classifying wounds under terms of the appearance as well as the etiology. And then we're going to show you how this classification system lends itself very readily to management algorithms for the excellent clinical management of these patients. So, what happens during that initial wound care consultation? Well, you've all been there. You've seen what happens. And essentially, there's a lot of information spinning around. It comes from a lot of sources. We start off with a history and physical. Just like we did in school when we were going through our clinical rotations, the basic element of any medical evaluation is a history and physical, and this is no different for a patient that presents to us in the wound care clinic. We get a good, thorough history, and then we do a physical exam, certainly a head-to-toe exam, but we do, in the wound care clinic, focus, I guess, more intently, if you will, on the wound, and that's certainly justified and understandable. We do a lot of stuff in addition to the H&P. We'll take photographs of the wound for documentation purposes, document in the patient's medical record. We may do things like get wound cultures, initial wound cultures, screening cultures. We may do procedures such as assessing the blood flow, whether it's through skin perfusion type pressures, oxygen measurements, transcutaneous oxygen measurements, formal vascular testing, screening exams such as an ABI, ankle brachial index exam. The patient may require an initial debridement. That may be performed as well during this initial consultation. However, all of this information and all these procedures leads to hopefully a final common denominator, and that's management decisions. So we take this information, we synthesize it, and we create a treatment plan, if you will, or a management algorithm, management decisions that are based on this information. And that's certainly a very important part of completing the initial consultation.